How to treat wounds and prevent infections after floods and storms. After floods and storms, the risk of injuries and infections from exposure to dirty water, waste, and pathogens is high. Understanding how to treat wounds and prevent infections is essential to protecting your health. Below is a detailed guide on how to handle wounds and safeguard your health when exposed to contaminated water. 1. Treat wounds immediately. Even small wounds should be treated right away to prevent infections, especially when exposed to dirty water. Clean the wound. Use clean water and mild soap to wash the wound. If clean water is not available, you can use antiseptic solutions. Example, if you get a scrape while cleaning up after a storm, make sure to thoroughly wash your hands before touching the wound and use clean water to rinse the affected area. Apply antiseptic solution. After cleaning the wound, use antiseptic solutions like 70% alcohol or iodine solution to disinfect the area. Example, dilute iodine with water and apply it to the wound to kill bacteria without irritating the skin. Bandage the wound. After disinfecting, use a clean bandage or sterile gauze to cover the wound, preventing direct contact with dirty water or polluted air. Example, use adhesive bandages or sterile gauze to cover the wound and change it daily to avoid infection. 2. Prevent infection from dirty water. After floods and storms, water is often contaminated with bacteria, viruses, and hazardous waste. Protecting your body thoroughly is essential to minimize the risk of infection. Avoid direct contact with dirty water when moving through flooded areas. Always wear protective clothing, rubber boots, and gloves to reduce the risk of infection. Example, if you need to wade through dirty water, wear long pants, waterproof jackets, and rubber boots to protect your skin from contaminated water. Wash your hands after contact with dirty water. Always wash your hands thoroughly with soap or use alcohol-based hand sanitizer after exposure to floodwater. Example, after cleaning up, use clean water to wash your hands or a hand sanitizer containing at least 60% alcohol to ensure bacteria are killed. 3. Monitor for signs of infection. Even after properly treating a wound, it's important to monitor for signs of infection and seek medical help if necessary. Infections can cause serious complications if left untreated. Symptoms to watch for. A wound may be infected if symptoms like swelling, redness, pain, pus, or a high fever appear. Example, if the wound becomes swollen or starts to discharge pus, you should visit a medical facility for proper examination and treatment. Consult a doctor if you suspect the wound is infected, especially if you experience symptoms like fever, headache, or fatigue. Seek medical advice for antibiotics if necessary. Example, if the wound hasn't healed after 2 days and shows signs of pus, visit a doctor for diagnosis and a prescription for antibiotics. 4. Nutritional support for wound healing. In addition to treating the wound directly, your body needs proper nutrition to support the healing process. Nutrients such as vitamin C, protein, and zinc help accelerate wound healing and strengthen the immune system. Vitamin C promotes collagen production, helping wounds heal faster. Example, increase consumption of fruits like oranges, pineapples, and kiwis to provide your body with vitamin C. Protein, the main component in new tissue formation, helping wounds recover. Example, incorporate chicken, fish, eggs, and legumes into meals to provide sufficient protein. Zinc supports skin regeneration and boosts immunity. Example, eat seafood, red meat, and seeds like pumpkin seeds to naturally supplement zinc. 5. Get vaccinated against tetanus and other infectious diseases. After exposure to contaminated environments, the risk of contracting infectious diseases such as tetanus, hepatitis, or waterborne diseases increases. Vaccination helps reduce the risk of disease and provides long-term health protection. Tetanus vaccination. If you get injured by sharp objects or deep wounds, visit a medical facility to get a tetanus shot. Example, after being cut by a rusty metal object, seek a tetanus vaccination as soon as possible. Other vaccines, besides tetanus. You should consider vaccinations for diseases like hepatitis A and B to protect against waterborne infections. Example, in areas heavily affected by floods. Ask your doctor about the appropriate vaccines to get. Conclusion. Proper wound care and infection prevention after floods and storms are crucial for protecting your personal and family's health. By following the measures above, you can ensure your body is well protected from harmful elements in contaminated environments and maintain your health more safely in the challenging aftermath of natural disasters.